Okay, yes. Hello, doctors, students. Once again, welcome to our 90-day University Prof pre-final mastery classes. So today we are in our systemic bacteriology part 2. We finished one, now we are 2. So once again here, what we're going to do is that we're going to have all the rapid revision of all important questions, volatile quick revision of all subjects which are very volatile. High yield topics and also the most expected topics will be covered in this. Okay, so it's not only for your prof exam, also it's going to be very useful for your next exam if you have, or neet exam and FMG exams also. It's going to be very, very useful for all of them, right? So now, what are important things? We already know about this. So what are the questions we're going to do today is, we have 2 long question and 4 short question. Long question, one is about the Staphylococcus aureus and other one is Streptococcus pyogenes. If you see here, Staphylococcus aureus and Streptococcus pyogenes, in exam, definitely you will have one question on this two. Either short or long, definitely you will have a question on Staphylococcus aureus and Streptococcus. You can't skip, yeah, especially pyogenes. And then short essay, of course, again, they might ask you about the beta lactamases, very important enzyme, and MRSA, methylase resistant Staphylococcus aureus. And also you will have this Staphylococcus epidermidis question, cones, and post-streptococcal sequelae. These all are important. There is no way you're going to skip the topic. Okay. Now, Voices Auricle, we already spoke many times about this. Recorded classes, live classes, practical session, exam module, and hard copy book set. These all are available in Auricle. Okay. Now, next is your recorded classes. In recorded classes, the good thing about recorded classes is the flexible learning, expert instruction, and then convenient revision. This is what you will be getting when you're having this recorded classes session if you're going through it. Okay. And then, apart from that, you can see we have live classes, which we're doing now, in-depth coverage, experienced educators, interactive learning will be there. And then comes your express exam module, where you'll be trained very well to complete the syllabus in 20 hours, then how to write the answers, and also expert educators will be teaching you how to perform this. Okay, yes. Next is, yeah, one-to-one doubt clearing session is a very new thing. Here you will be given just basically a student-centric approach. It means personal attention, safe learning environment will be there. You can ask all your doubts and get it cleared. Okay, this is the best part. And here, hard copy notes you need. Anyway, either whatever you learn from online, better is to have a hard copy set. So we will be providing it for you. So it's going to be very, very easy also. And then next is your question bank. We have good amount of questions, very sufficient to, if you cover the question bank easily, you can pass your exam, not only pass, get good score with the exams. So practical sessions will also come soon. So you will be very, no need to worry. Practical is one of the easiest thing, which we're going to make it very easy for you. And this is a subscription plan. So we have all the foundation plan, advanced learning, complete learning, and ultimate MBBS plan. So look at the prices and choose whatever is good for you. You can use this code Dr. Santhosh Rajan 20 and get a discount for that also. Okay. So this is all our thing. So now we are going to a topic. The first topic is like this. Name the question, name the pyogenic cocci, and then you have to discuss the morphology, culture, the biochemical, and the virulence factor, and diseases caused, okay, and also laboratory diagnosis of Staphylococcus aureus. So these are the things, okay. So now, first one, name the pyogenic cocci. When you talk the pyogenic cocci, see two important cocci, if you forgot also, when you talk about cocci and bacilli bacteria, cocci is a big part. In cocci, there are only two, Staphylococcus and Streptococcus. So Staphylococcus, number one. Pyogenic means pus forming, pus causing, anything related with the pus forming. So first Staphylococcus, other one is Streptococcus. So Streptococcus. So in Staphylococcus, the most important one is, aureus, which is the main pyogenic. It is the king of pus, you can say. It causes abscess, it causes furuncle, carbuncle, so many things we're going to talk. Okay, so other one is your Streptococcus. The name itself says so pyogenes. Pyogenes. Okay, that's it. These are the two important pyogenic cocci. If they ask you to name the pyogenic cocci, these are the two things. Yes, you can write other things, not that important, but they can also cause, or it could be your cones, especially epidermidis, enterococcus. They're all are cocci only, but they are rare. These are very rare cocci. So only two things: Staphylococcus aureus and Streptococcus pyogenes. Again, we have this two are like important for long essay questions. Okay, right. Now next one. What we're going to talk next is your main thing. There's a Staphylococcus. The topic now is like this. It's your Staphylococcus aureus. Staphylococcus aureus. So it's a 10-mark question. Okay, easily. It's a long essay question. They can ask anyway. So first point is the morphology. So now you're going to talk about the morphology. When you talk about morphology, it's very, very simple. I always told you, remember staff means, remember staffs like grapes, no? Staffs like grapes and staffs like cat. So this is very important. So based on that, what you're going to write, it is like this. You're going to draw the picture also. You draw a picture when you talk about staphylococcus. Okay. So you're going to draw like this, and this is what? This is a positive gram-positive cocci, which is looking grape-like cluster. Grape-like cluster. Okay. So I told you to remember like this. Always remember staffs. No, staphylococcus staff. So staffs in the hospital, any nursing staff, doctor staff, any staffs, they like grapes. Another important thing is they like cat. Remember, they have a cat. Okay, means catalyst positive. Just which I want to say. Okay. So this is a morphology. You're going to write gram-positive cocci, grape-like cluster. This is much only for morphology. Now next. They asked about the cultural characteristics. Cultural characteristics, we are going to talk in the diagnostic process. We are going to take the culture characteristics. So I'm going to leave that one later. By virulence factor, so culture, biochemistry, and then this morphology, it will come now. Now we'll talk about the virulence factor first. So what talk about virulence factor? You should know that it has very important enzymes that is causing a lot of problem. Cause all the pus infection, everything is because of that only. So what are they? Let the shortcut be like, remember, like depth. DEPTH. Staffs, they work in depth. Remember like that. Okay. So D for DNAs. E for enterotoxins. It has very important, very dangerous enterotoxin, especially A and F are very, very dangerous. You have to mention it. Okay. And also, you remember epidermolytic toxin, epidermolytic, which is causes SSS, Staphylococcus scaldus skin syndrome. We're going to talk about epidermolytic toxin. Okay. And then P. You have a lot of things. One is your phosphatase enzyme. Other one is your penton valentine leukocidin toxin, PVL. Okay, and of course, one more thing, 3Ps will be the protein A, which is helping in coagglutination test you are using. Okay, you just remember P. So 3Ps will be there. Okay, depth. T for thermonuclease enzymes. Okay, thermonuclease enzyme, and H for hemolysis. We have a lot of hemolysis. Okay, that's it. So this is the virulence factor covered. Okay, now next you're going to the disease caused by this thing. Now we're going to the disease part. Okay. Now, what is the next one? To clear it, we're going to the disease part. So, when you talk about the disease, you classify the Staphylococcus aureus disease into two things. What are they? One is the disease caused by bacteria itself. Okay, first one. Second one, the toxins, the toxin mediated disease. So two types. Okay, one is the bacteria itself and other one is your toxin mediator. Bacteria itself means anything related with the pus. Okay, you have a lot of pus, so whatever the pus causing infections will be here. So now let's go in, we are talking about the pus thing. So first thing, let's talk about the skin and soft tissue infections. Okay, when you talk about skin infection, so big list is this skin, and then comes your bone. Okay, bone, what infection it causes? Important infection. And then apart from that, not only skin and bone, it also causes something in your lungs. Okay, it's lungs. Then also it causes something in your heart. Okay, and then okay, I'm going to write it. Toxin, we'll write it later. Okay, next page we'll write. Okay, skin, heart. Okay, and then what else it causes? It can affect even your which would skin, bone, lung. Of course, it cause special disease in your parotid gland and also in your breast, and then something very similar to fungus. Like fungus, I'm going to write there's an infection very similar to fungus. This all can be 1 mark questions also. Okay, so skin infection, let's start from the basic folliculitis. Most common cause of folliculitis, most common cause of furuncle, most common cause of carbuncle, and most common cause of abscess. Everything is your Staphylococcus aureus. So important. You have to know this 1 mark questions also, and you can here also to mention. Okay. So any skin and soft tissue infection, this all will be there. Okay, one right. Bone. Most common cause of osteomyelitis. You know that one. Yeah, except sickle cell anemia, it is the salmonella. Otherwise, every case, it's the Staphylococcus aureus. In lung, of course, it causes the pneumonia, especially hospital-acquired pneumonia. Okay, pneumonia. It is causing usually hospital-acquired pneumonia. Heart, we just spoke, one of the most common cause of acute infective endocarditis. Basically, any infective endocarditis, most common cause this only, but acute infective endocarditis most common. Parotid, you know that it cause most common cause of parotid abscess. Also, normal parotitis also. In breast, of course, most common cause of mastitis. and also abscess. Anywhere abscess word comes, you remember only Staphylococcus aureus. It is like so this is like fungus. The disease name is called Botryomycosis. This question also will be asked. Botryomycosis is not a real fungus. It is basically due to Staphylococcus. One of the, even E. coli can cause, but you remember this is one of the main cause. Okay, so these are the common things you will see with the disease caused directly. Now, toxin mediator is very, very important. So now we're going to talk about, this is bacteria. Now, second one, I'm going to toxin mediated diseases. For toxin mediated Staphylococcus, toxin mediated diseases, three diseases are there. Okay, you have to remember three diseases. So what are they? The first one is your food poisoning. Okay, first one is your food poisoning. Poisoning, food poisoning. Okay, second one is your toxic shock syndrome. Toxic shock syndrome, dangerous one, very dangerous one. Toxic shock syndrome. And then the third one is your Staphylococcus scalded skin syndrome. Okay, I'm going to write it here. Staphylococcus scalded, actually 4S, scalded skin syndrome. Okay, this is not that dangerous. The worst one is toxic shock syndrome is the most dangerous one. Okay, now each one, which toxin is causing what? Food poisoning is caused by the enterotoxin A. Enterotoxin A. This is first point. Okay, first question. Here, toxic shock syndrome is caused by enterotoxin HEF. Okay, HEF. Otherwise, also they call it as toxic shock syndrome toxin, TSST. Okay, what about Staphylococcus scalded syndrome? This is called some scalded skin. Skin means something related to skin. So epidermolytic syndrome. Epidermolytic toxin, or sometimes exfoliative also you call exfoliative toxin. Okay, toxin names are important. One more question will be asked from this. Okay, now next, the diseases. So it's a food poisoning. So A, you remember in Hindi, A for aloo. Aloo is basically potato, right? Aloo is basically potato. So the disease caused by which food? Potato salad, and any pastries. Any pastries, ice cream, cream, any cream, whatever it comes, it is because of this. And what happened? This is one of the shortest incubation period. Within 6 hours, incubation period, you will have vomiting. Severe vomiting will be there. Not diarrhea. Vomiting is more in food poisoning. Okay, this much you should know. Food poisoning. Toxic shock syndrome. Everything is about HEF here. It is HEF. Why? Because HEF for toxin HEF. Another one is female. Why have another F is fatal? Yes, this is dangerous. Which female? Females are using the tampons, which is contaminated. Tampons, unhygienic tampons. So because of that, what happened? They will get shock, and patient will have shock plus fever, fever, and it can, if you not treat immediately, the patient can die also. That's what it is, fatal. Okay. Staphylococcus scalded skin syndrome is most common in children. You see the children's with all the skin is peeling, no? That this is only. Basically, you say that as Nikolsky sign positive. Basically, what happens? Superficial peeling will happen. Superficial peeling of skin will be positive. Superficial peeling of skin is positive. But it's not that dangerous. Good prognosis. If you take antibiotic, prognosis is good. That's it. Okay. So these are the toxin-mediated disease of your Staphylococcus aureus. Very, very simple. Okay. Yes. Now, next one. Yeah, so disease is over. This much only for disease. You write this briefly. This is at least out of 10. This is just 3 or 4 marks they'll give you for this. Okay. Now we're going to laboratory diagnostic part. Laboratory diagnosis. So here comes all your enzymes, the biochemical test and culture will come here. Okay. So lab diagnosis. The first thing which you're going to talk is your, always when you talk about lab diagnosis, you have to go in an order for bacteriology. For virology, it's always we talk, it's just serology and the PCR for common for everything, and sometimes cell lines. But there is no culture here. But here, you start with microscopy. When you say microscopy, you do gram stain. So in gram stain, okay, first thing, microscopy, gram stain, okay. Second thing, you have to try to put the culture. Which culture media, where it grows. And third one is your biochemical tests. What are the, for every bacteria, you have to remember, this is the sequence. You have to write these things. At least microscopic culture is mandatory, and biochemicals again depends upon what organism, whatever you're getting. Okay, so now we are right. Now let's start right. Gram stain, we already told Staphylococcus aureus is gram positive cocci in clusters. In grape-like cluster. Okay. Grape-like cluster. If you want, you can draw a picture here also. No problem. Okay, the examiners will be happy only. When you talk about culture. Now, when you talk about the culture, look, what are the culture media we are using here? So, we are using here, one is the blood agar. Commonly used blood agar. Second one is your nutrient agar. Commonly used for every bacteria. Okay. And third special, we have special only for this thing, mannitol salt agar. Remember, mannitol salt agar. Staffs like mannitol. Okay. So staffs like mannitol salt agar. Okay. And then blood agar, mannitol salt agar. Yes, these are the main important medias which we have here. Okay. For staphylococcus. Now, what we are going to do here. So here, and one more also, Ludlam's. Ludlam's agar. Okay. Ludlam's agar. Now, what we're going to do here, blood agar, you know that this is producing beta hemolysis, means complete hemolysis. Okay. So you have to beta hemolysis with pinhead colonies. You remember staffs or head, no? Head staff, head nurse, head staff. So pinhead, head, the word is important. I'll tell you why pinhead is important. Pinhead colony. This can be one more question also. They'll ask you all these questions. Okay. Nutrient agar, it produces what pigment? Golden pigment. The name aureus, right? Staphylococcus aureus. Aureus means it's gold. So golden yellow pigment. Golden yellow pigment. Okay, this point. Every point is a scorer for you. Okay, so it's a question. Mannitol salt and Ludlam's, these two are selective medias. Selective medias. That's it. This you're going to write. Okay, this point you're going to for culture. Biochemicals. Biochemicals, what you do? The basic test is in starting itself, I told you, starts like cat. So first one is catalase enzyme positive. Catalase positive. It is positive only for staphylococcus, but in streptococcus, catalase is negative, right? Remember, that's also one more question. The main difference to differentiate staphylo and strepto is catalase. Okay, the biochemical. This kind. Apart from that, coagulase. Coagulase, see, catalase for all staph. But coagulase test you're going to do, which will be positive, both tube and slide coagulase. We have tube and slide coagulase. Tube and slide coagulase, both, okay, will be positive. Apart from that, we just spoke DNase, thermonuclease, even phosphatase. Okay, so these things are very specific for. In fact, phosphatase, I'm going to take phosphatase is for all. This was it's for. It is not specific one here. I'm going to erase it. Why I'm saying this one? One second, because you have to know very well that here these things are these enzymes, coagulase, DNase, thermonuclease, are specific for only Staphylococcus aureus, not even cones, not even to other Staphylococcus, only for Staphylococcus aureus. It's very specific. This much. If you write this much, examiners will be more than happy and they'll give you full mark. Okay. So catalase test, coagulase, thermonuclease is all the things you have to do. This much only. Okay. So this is an elaborated and 10 mark question. Easily you can score. So there is no way that you're going to miss this one. Okay. Now, next question. We have done with our Staphylococcus now. So you can see all explanations given here. Okay. Everything, nothing is missed. You can check the diseases also here. And you can see food poisoning, everything is given here. Culture media and all the tests are mentioned here. Now we are going to next question of streptococci. Streptococcus. So classify the streptococci. Then morphology, pathogenesis, virulence factor, enzymes produced by streptococcus pyogenes, and lab diagnosis. Very easy and simple. Yeah. So you can always expect. So first of all, we're going to a streptococci classification. Streptococci classification. When they ask about streptococcal classification, it is based on one thing, hemolysis. It is based on hemolysis in blood agar. In blood agar, we have to check for the hemolysis. So based on that, you will have beta hemolysis, beta, alpha, then comes your gamma hemolysis. Okay, you have beta, alpha, gamma hemolysis. Now here what you're going to do is that beta hemolysis means it is a complete hemolysis. Complete. That means if this is a colony, you will see a clear zone of hemolysis will be there. Okay. But in alpha hemolysis, it is partial. It's not complete. It's a partial hemolysis, means around the colony, there will be like little bit greenish pigmentation will be there. Not complete. That's what we call partial hemolysis or alpha. Gamma means no hemolysis. There is no hemolysis. Okay, so this is the classification. Now look at this. Examples you have to give. So beta hemolysis, two bacteria. Which one? Group A and Group B. Group A and Group B. Group A is basically your Streptococcus pyogenes. Streptococcus pyogenes. Other B is basically Streptococcus agalactiae. Agalactiae, which causes meningitis in children and infective endocarditis. Oh, sorry, mainly meningitis in children. That is very important there. Okay, and sepsis. Pyogenes is one which we're going to talk in a while. Partial hemolysis, we are going to talk about Streptococcus pneumoniae, Streptococcus pneumoniae, and Streptococcus viridans, which we spoke yesterday, which is cause of the subacute viridans, subacute infective endocarditis. Okay, and gamma is basically enterococcus, and other one is your Streptococcus bovis. This much. This is the classification of your streptococci. So this will be 3 marks on a 10-mark question. We will get 2 or 3 marks for this. Okay. Now, next, we are going to talk about now the main topic is our Streptococcus pyogenes, the main infection, which is Streptococcus pyogenes. Okay. Now, what is the question? First one, they asked about the morphology. So when they ask about the morphology, okay, first one, morphology. So you're going to write here, this will be like this. Streptococcus, like a strip, like a strip. So it is gram-positive cocci in chains. Gram-positive cocci in chains, morphology. This much only you'll write. Okay, that's more than enough, morphology. Pathogenesis. Now, next is your pathogenesis. In pathogenesis and virulence, I'm going to write pathogenesis and virulence factor, pathogenesis and virulence factor. Here, you know what happens here is, what are the virulence factor? The most important one here is hyaluronidase enzyme, number 1. Number 2 is streptolysine O, and then we have streptolysine S, and also we have one more thing called streptokinase. And also one more thing is there, which is called erythrogenic toxin. One toxin also. So all have their own role and it's all are important. Okay, what are this role? We are going to talk now. Hyaluronidase is helping in the spreading infection fast. Spread the infection fast. It breaks the barrier between two cells. So it goes very fast. And also if you see the pus here is serous discharge. So there is no pus. You have a serous discharge. The pus breaks down and it looks watery. So that's what we call serous-like discharge. It is a pus, but it is very watery discharge will be there because of this enzyme. And streptolysine O is the one which causes, remember, rheumatic fever. This is basically, streptolysine O is also oxygen labile. It's oxygen labile and causes rheumatic fever. Streptolysine S is oxygen stable. Nothing to do with this. It is not much significant here. Which is first one is immunogenic. That's what causes rheumatic fever. This is not causing anything. Streptokinase, which is used, is not here. It doesn't have. It is used in MI patient, myocardial infarct patient as fibrinolysin. You would have studied in medicine and pharma, fibrinolysin. Erythrogenic toxin is basically red color. So it means this is the one which is causing a scarlet fever. Okay, scarlet fever. These are the things. The virulence factor. Now, okay, very simple. Now what you're going to do is then we're going to talk about the diseases. So virulence factor means diseases, pathogenesis. So because of all these enzymes, what are the common diseases? There's very few diseases, only very characteristic. One is erysipelas. Erysipelas is a superficial mild form of cellulitis, you can say. Then if it becomes bigger, it goes to cellulitis. Then also it causes necrotizing fasciitis, very severe form. When there is, it goes into deep tissue, you will have severe gangrene and all. So those things are formed, okay? Cellulitis common in diabetes mellitus patient. So erysipelas superficial, okay? Because it's spreading first due to hyaluronidase enzyme, okay? Necrotizing fasciitis and also your scarlet fever. Just we spoke scarlet fever, the one which has the strawberry tongue, if you remember. Okay, so these are the diseases causing here. Finished. Now, next point is your, they asked to put a laboratory diagnosis. Now we'll talk about the laboratory diagnosis. Laboratory also very easy. Okay. Now, what we have in the lab diagnosis of Streptococcus pyogenes? In Streptococcus pyogenes, one more thing also, we forgot to classify the Streptococcus. I'll tell you after this, I'll talk. Okay, first we'll go to lab diagnosis. In lab diagnosis, again, same thing. First, you have to always explain about the microscopy. That is your gram stain. Microscopy means in gram stain, what you're going to see. And second one will be your culture one. Culture, then the biochemicals, if anything is there, biochemicals. Okay, biochemicals, if anything is there. Okay, now microscopy, when you talk about the microscopy, gram stain, same, it's a gram positive cocci in chains, cocci in chain. Okay, fine. Now in blood, in culture, one is your blood culture, blood agar is common, nutrient agar doesn't have any significant here. So we have other thing called Pike's media. Pike's media one is there, and one more, if you remember, crystal violet. Crystal violet blood agar, or also there's one more called PNF. This is polymyxin neomycin fusidic acid media, PNF media, to selective these two this in. Okay, now how to explain here. So blood agar, you will see again beta hemolysis, as we told, both group A and B with pinpoint colony. Remember, in Staphylococcus it was pinhead. Here it is point. Strep is like a strep P pin. Okay, pinpoint colony. Pike's media is basically transport media. You transport through Pike's, P for P, transport media. Okay. What about this crystal violet? Crystal violet is the selective media. Crystal violet and PNF is the selective media for this thing, for our these are the Streptococcus pyogenes. These are the points you're going to write. Biochemical, to differentiate the Streptococcus pyogenes, there's two tests are important. One is bacitracin sensitive, bacitracin test sensitive, and other one is there's something called PYR test. Okay, this will be also positive for this. PYR, pyogenes only, easy. Pussy, how you want to remember. Okay, pus. So these are the two tests biochemically which is characteristic for your Streptococcus pyogenes. This much only. Okay, so if you know this, this is more than enough. Now, yes, I forgot the classification. One more question they'll ask you for Streptococcus pyogenes. Pyogenes classification. For pyogenes, this is not for all, only for Streptococcus pyogenes. So this Streptococcus pyogenes, two classification. One is based on the carbohydrate. Other one is based on M protein. You will have definitely one more questions from this. That's what I'm classifying. Okay. We have question both. In carbohydrate, based on the carbohydrate, we call it as a Lancefield. Lancefield, you have a clue. C for Lancefield. Lancefield classification. So in this Lancefield classification, what happened? You have this classified into from group A to V. So many is a group A to V is there, except I and J, except I and J, it is not available. That's it. Okay. And M protein, this classification is called Griffith. Griffith. Griffith classification, which is based on M protein. If you forget also GM motors, you know? MG or GM motors, very popular in India. So shortcut, M protein, this also a question will be asked. In Griffith classification, what you do, group A is further divided into more than 100 subgroups. That's it. This much only. The idea is for you to know the carbohydrate classification, carbohydrate in the cell wall. Yeah, carbohydrate in the cell wall. C for C. Okay. Lancefield classification. Other one is based on M protein Griffith classification. And then the disease we already spoke. Okay. This much only. This is for your Streptococcus viridans group. Very, very simple and easy. So Streptococcus viridans is some topic that you can't make mistake to easily score also. Okay. That's all. So we are finished with this. So everything you can see here. See in this picture, beta, alpha, hemolysis, everything is mentioned, right? And then you can see everything, all where we spoke now, everything is mentioned here very clearly. So diseases, pictures also, if you want. Yes, and one more thing, Streptococcus pyogenes infection we didn't speak because that was separate question also. Here, once again, let me see in the question it was asked. Yes, in question they didn't ask about the disease. Okay, anyway, the disease is coming behind. When I spoke about the disease, We spoke only about the skin infections, okay? But Streptococcus pyogenes causes two. One is autoimmune. Okay, we will write it here only. I don't mind writing it here. We'll finish it here only. So now when you talk about the disease, this can be short notes also. The disease of group A, Streptococcus pyogenes, it can be short note also. Pyogenes, because this is little bit longer and easier. Disease of the group. So you classify it into two types, the disease. One is like this. One is the bacteria itself. Again, it is the bacteria itself. And other one is the autoimmune diseases. Streptococcus pyogenes cause autoimmune diseases. This is very, very important. Okay, autoimmune diseases. So now bacteria itself, what are the disease? We just spoke all those things. Erysipelas, cellular. These are all these are the skin infections basically. One is your skin infection, Erysipelas, cellulitis, necrotizing fasciitis, we just spoke next to fasciitis, and scarlet fever. But don't forget one important thing in the throat. In throat, it is the most common cause of bacterial pharyngitis. Okay, so it causes the acute pharyngitis. Acute bacterial pharyngitis, most common cause bacterial pharyngitis. Tonsillitis, pharyngitis, whatever. Okay, tonsillitis. This is the bacteria. This is the most common cause. So that is one. Okay, you have done with this. When autoimmune disease only, we have two diseases. That is, one is your rheumatic fever. We have separate questions, so I'll explain detail there. Okay, other one is your PSCN, post-streptococcal glomerulonephritis. Okay, we will talk about that. And some goutarditis, psoriasis, and reactive arthritis also. We'll talk in detail, but these two you should remember this much only. Okay, fine. Now, next thing. One, yeah. So these are the things you have to remember. It's very, very, very important. Okay, that's all. Now let's go to the topic. The question where to, okay, gas, it's all done. Okay, we told about all these things. Yes, now give a short note on beta lactamase and its importance. Beta lactamase, as you know, first of all, let's write this. Beta lactamase is a very, okay, now beta lactamases are, first point, this is the enzyme. What happened? It breaks which antibiotic? Beta lactam antibiotic, which breaks the beta lactam antibiotic. So what happened? Antibiotics, beta lactam antibiotics, and because of its breaking the beta lactam antibiotics, so it can't kill the bacteria. So the bacteria survives easily. Okay, that's the first thing. It breaks the beta lactam, or it doesn't allow the beta lactam to enter inside the bacteria, whatever. So the bacteria survives. They can't kill the bacteria. Now, this is the first point. So now what happened? How would this beta? These are basically plasmid mediator. They are plasmid mediated. Okay, and they transmitted from one bacteria to another by conjugation, or usually conjugation. If you remember, in general bacteria, we spoke two bacteria, one bacteria, another bacteria, they form a conjugation too, and this resistance is transferred to another one like this, or by transduction. Transduction in case of Staphylococcus, only in Staphylococcus aureus or Staphylococcus, you have this transduction where bacteriophage enters into that cell and then it transfers from one bacteria to another through bacteriophage. That's called transduction. Okay, so these two mechanisms. Okay, plasmid mediator, Staphylococcus aureus tension. Okay, that's it. Now, what about this? So now this beta lactam is a big problem. So it can be, it's not only one, this is the beta lactams are produced by both gram positive and gram negative bacteria. Both are producing this. Okay, both are producing. Fine. Okay, this is the first point you're going to write about beta lactamases. Now this is next one. Beta lactamases are penicillinases. Okay, before you used to call it as penicillinases. They're same only. Beta lactamase. Beta lactamase is better word. That's it. Okay. So now let's talk about the types of beta lactamases. We talk about the types of beta lactamases. Yeah. Now, what are the types we have? First one is the ESBL, extended. This is called extended spectrum beta lactamase, number one. Okay. And then we have AMC beta lactamases. Okay. And the last one is Carbapenemase. Carbapenemase, okay? Carbapenemase. So these are the three things: ESBL, AMPC, beta-lactamase, and carbapenemase you're going to write. And now what happened? The points are very important. This one, usually, which drugs will not work? It is usually resistant to, they become resistant to beta-lactam and combination drugs, beta-lactam and beta-lactam combination drugs. Okay, not to, it is not resistant to still carbapenem and cefamycin. I will just check if I have a chart here. It will be even more better. I think there is no chart here. It's okay, no problem. Okay, cefamycin, not to this. That is the first point, definition. AMPC, what happened? This is resistant to once again, this point, it's mentioned here, or I'm just checking whether to change it or not. Once again, yes, let me just make it like this. This is same like the ESBL only. ESBL plus resistant to cefamycin. Cefamycin. Okay. Now, carbapenemase is AMPC plus the carbapenem drugs also. Carbapenem resistant to carbapenem resistance also. Means everything is resistant. Okay. This is the idea. Okay. Beta-lactam, ESBL is beta-lactam combination drugs. Means it is resistant to the penicillin, cephalosporin, especially we're talking about 1, 2, 3 generation, and monobactams. Okay, monobactam. These are the common beta-lactams. So it's resistant to all, but not to your carbapenem and cefamycin. Still it's working. But in AMPC, it is resistant to cefamycin, but not resistant to everything, but not to carbapenem. Even carbapenem is working. Carbapenem is working. But carbapenemase, it is not working to anything. Everything is resistant. So in these cases, only what you do for treatment, you will be giving beta-lactam plus beta-lactamase inhibitor drugs. Okay, beta-lactam inhibitors, beta-lactamase inhibitors combination drugs you give. Okay, that's it. This much you write, more than enough. These are the, I should write it here once again, beta-lactamases. Okay, types of beta-lactamase, 3 beta-lactamases you want to write. Okay, so everything is already mentioned here. You can check here also. Okay, how everything, so 3 extended means what, and then followed by your AMPC and carbapenemases. And yes, one more thing, in carbapenemase, again, you have this one called Klebsiella pneumoniae KPC and New Delhi metal beta-lactamase subtype. If you write, that's also an extra scoring only for you. Otherwise, also it's fine. Whatever we spoke, that you write, it's more than enough. Okay, these are the beta-lactamases. Very, very simple, maybe complicated. It's more you in pharma you must have studied, but still, this question you can expect in a short notes. Okay, easily they can ask. Now, next question. MRSA, methicillin resistant staphylococcus. This is very, very important. Easy topic also. You don't have to struggle with this. Methicillin resistant staphylococcus aureus called MRSA. So, first point itself you should write. This is mediated by, this type of resistance is mediated by which one? By your MEK-A gene. MEK-A gene. This is a MEK-A gene. What does it do? This gene, what happened? The normal, it converts the penicillin binding protein penicillin binding protein to penicillin. This MEK-A gene converts PBP2 into PBP2A. This is the normal one, and this becomes abnormal. So what happened? Because of this, it become resistant to lot of your lactams, beta-lactams again. Okay, to all your methicillin, all the primary whatever penicillin group drugs, they become resistant. So this is the MRSA resistance. Okay, resistant. That's it. So this is the main thing. MEK-A, PBP is converted to PB2A, then they become resistant to drugs, resistant to antibiotics, all basic antibiotics. Okay, fine. Now, types. We have 2 types. One is the very simple type. One is hospital acquired. Other one is community MRSA. Hospital and community MRSA. The hospital one community difference is not much. The idea is in hospital, they are multi-drug resistant. They are usually multi-drug resistant. these MRSA bacteria are multi-drug resistant. Here in community, MRSA bacteria are usually high virulent. They have high virulence. Okay, so here the genes are, if you see McKay, the McKay strains, it will be 1, 2, and 3. Always hospital first 1 to 3. Here it would be McKay strain 4, 5, and 6 will be there. That's it. This much only. This is the main difference between these two. Okay, otherwise a disease and all causing same that ICU issue almost in hospital community related only. Not much. Okay, that's now the most important part is your diagnostic part. How do you diagnose MRSA? Diagnosis of MRSA and treatment. Diagnosis of MRSA and treatment of MRSA. These are the important treatment of MRSA. So diagnostic part, you always know this, we're talking about a gene. So definitely the best one is, of course, your PCR. PCR is the best one. Second. So what is number one? Number one is basic test, which you're going to do. You have to put a cefoxitin disc test. Screening purpose. Or there is something called oxacillin MIC test. Minimum inhibitory constant. These two are for screening. Okay, screening tests. And PCR would be the confirmatory test. Nowadays, we have even latex agglutination to detect one PB, penicillin binding protein 2A. We can detect this also. Okay, so these are the three things, important things for diagnosing the MRSA. Treatment for MRSA, I always say, students, remember, just whenever somebody is getting MRSA in hospital, tell them to simply be quiet and see what? Television, TV. See TV. Okay, so ideally, I want to say C for cephalosporin. Cephalosporin 5th generation drugs. T for teicoplanin. And of course, the drug of choice is vancomycin. And vancomycin comes, always there should be linezolid also. Linezolid. So these are the treatment options. Okay. Cephalosporin, teicoplanin, vancomycin, and linezolid. These are the things when you have an MRSA patient, you're going to give. This much. Very, very simple and easy. There is nothing to, think too much. So I'm sure that, you guys will score in this MRSA. You don't make any mistake. Okay. Now, next. So now you can see where we are. Yes, big like message we done. Yes. So I mentioned, yes, everything is mentioned here. What was same thing? Yeah, risk factors, basically hospital and community setting. This is basically poor hygiene, close contact, contaminated material, obvious things. Okay. And then this also community and these two differences mentioned here. And again, detection, how to do, and treatment, what we are going to do. Everything is mentioned. Okay. Very, very simple, easily scoring 5-mark question is that. Okay. Now this question is another very easy question. They just give 2 lesions of, if you get question like this, you'll be very, very, happy because, see, it is just the lesion only they asked. Some lesion caused by Staphylococcus epidermidis. So basically that is cons. Cons, you have 2 diseases, Staphylococcus epidermidis and saprophyticus. So here it is Staphylococcus epidermidis. Cons means, it's a coagulase negative because only Staphylococcus aureus give coagulase positive. Rest all Staphylococcus are negative. So we call it as cons, Staphylococcus aureus. So usually you should know that it causes any infections related to prosthetic devices, or any shunt or any cannulas, any IV catheter or cannula related infection, because it forms what? Biofilm. So you already told these are the infection related to prosthetic device, shunt, catheter, cannula. So now if you want, they ask 2 lesions, they ask only 2 lesions. So first lesion is the clinical feature. One is we already spoke, infective endocarditis. It causes the subacute infective endocarditis, especially prosthetic valve. In the prosthetic valve, first point, you will get 1 mark for this. Okay. Yes. Next one, it can cause stitch abscess. Stitch abscess is very, very characteristic. Abscess. Okay. Stitch abscess, subacute infective endocarditis, stitch abscess, and of course, a lot of infection related to cannula related, or you can write shunt also, cannula or shunt related infections. This much only. This is enough for staph epidermidis. Okay. Easily scored. This should be a 2-mark short question only somewhere added, but doesn't matter whatever it is. So this you should know because this is related with the biofilm forming. So because of the biofilm, there should be some device, foreign device. Okay. So there only it causes the disease, Staphylococcus epidermidis. Okay. That's it. Now, next. So mention everything's mentioned here. Yes. Now we are going to the last question. That is the post-streptococcal. The question is define post-streptococcal sequelae and the non-suppurative complications. So what is this? Basically, when you talk about the post-streptococcal sequelae, it is because of the main reason for this is due to autoimmunity. That is important. You're going to write autoimmunity. Autoimmunity means there the streptococcus pyogenes antigen is cross-reacting. Any antibody formed against the Streptococcus pyogenes cross-reacting with the human antigen. Human antigen. Okay. So what are they? So example here, what we're going to write is examples, this M protein of this, these are for Streptococcus pyogenes. Okay. And it cross-react with the humans something. So humans which structure? M protein, other one is your carbohydrate. We'll talk only about a few things, okay? Carbohydrate, M protein, carbohydrate, and one more thing is that one of the hyaluronic acid or hyaluronidase, okay? So these things cross it with something else. Human M protein will cross it with the human myocardium. And that is what we have. That is what we have this. We have infective endocarditis we are getting. The rheumatic fever we are getting. We are getting rheumatic fever. Carbohydrate C. So it invades the cardiac wall. So of course, we can have what? Again, infective endocarditis or any particular disease related to wall we can have. Hyaluronic acid is very similar to human synovial fluid. So that is what people are very prone to get arthritis, reactive arthritis. Okay, arthritis. These are the common things you should know. Now, what are the diseases? This is the autoimmunity is the main reason for post-streptococcal sequelae. You won't write this. Then diseases, examples. Now, what are the example of the disease caused by this thing, autoimmune diseases? They are basically, first one is your rheumatic fever. First disease. Second is your post-streptococcal glomerulonephritis. We call PSGN. Okay. And not only these are most important. Apart from this, there is something called guttate psoriasis, a type of psoriasis. After Streptococcus pyogenes, you get it. Okay. And also reactive arthritis. And there's one more disease called panda. It's usually 1-mark question or INCT Ames question they ask. Okay, panda is another disease. This is basically a neuropsychotic disorder associated with the streptococcus. Okay, guttate, psoriasis, and pandas. That's it. These are the disease. Now, let's write about the each disease. Now in rheumatic fever, very you guys already must have known, very commonly known. So rheumatic fever and post-streptococcal glomerulonephritis. First of all, this one you should know, this is very lifelong important in medicine. Also frequently the medicine and pediatrics may definitely will always been asked. Okay, so very important medicine. So this is like one of the most important diseases. Rheumatic fever, you know that here this is usually after pharyngitis. After pharyngitis of streptococcus pyogenes comes. But post-streptococcal nephritis usually after skin infections. Anything called your necrotizing fasciitis, cellulitis, or any skin infection by this thing, a streptococcus pyogenes. Okay. After this is the triggering factors, pharyngitis, here to skin infection. Now what happened? Rheumatic fever, the clinical features, we are going to follow the Jones criteria. Major and minor criteria, Jones criteria. I've written here also. You forgot also. You can remember like this: GONES. J for joint, O looks like a heart, no heart. N for, so joint me, you will be having, you know that one, migratory arthritis, big joint, the joint pain will go here and there. In heart, it causes, of course, mitral stenosis, mitral regurgitation, aortic stenosis, aortic regurgitation, etc. Okay. N for nodule. Nodule where in the skin, you have a skin nodule. E for erythema marginatum. You know this lesion, characteristic. All are important for one more question. Definitely MCQs easily can be asked. Erythema marginatum. Erythema marginatum. Okay, erythema marginatum. Yes for Sidon, Hams, Korea. So this is when involving the brain. Okay. So these are the clinical feature of rheumatic fever. Okay. Where in post-apical glomerulonephritis, what you will have is that you will be having nephritic syndrome. Nephritic syndrome. So nephritic syndrome, basically in nephritic syndrome, you usually have what? You will be having this a cola color urine. If you remember, cola color urine, very characteristic was post-apical glomerulonephritis. And also this patient usually have hematuria, mild proteinuria, mild edema, things will be there, mild edema. These are the few characteristic features in the nephritic syndrome. Okay, you know that you will be lifelong, you'll be studying it only. I don't want to explain it. Now, the diagnostic part. For diagnostic, what you do for rheumatic fever, you have to check for ASLO titer. ASLO, anti-streptolysin O, right? ASLO titer should be more than, it will go more than some place 200, some place 200. So basically, it goes, you can just, ASLO titer rises, increases. Okay, depends upon that unit. Here, in post-apical glomerulonephritis, you will be having which one? You will be having this one called, which one? Anti-DNase, antibody. This will be raised. Okay, more 200, 300 range it will be. Okay, this much only. This much you write, more than enough. The examiners will be happy and they'll give you full score. And of course, these are the major criteria in Jones I told. Okay, so these are the major criteria. But we also don't forget we have minor criteria. In minor criteria, you know that there is fever, heart rate increased, tachycardia, CRP increase, ESR increased, WBC increased, all lab related things will go high. These are the minor criteria, joint pain, etc. So now you know, accordingly, you should have two major criteria or one major plus two minor, but major should be there, not like our, which one? Your Duke's criteria, modified Duke's in infective endocarditis. There, you sometimes you can have just simply, some three minor is more than enough to say like that. And here it is not. Here you need to have five minor also. It's a diagnostic. Here you should have at least one major. Okay, definitely with the two minor whatever. So that's it. This is the non-suppurative, the post-operative sequel and non-suppurative infections of our Streptococcus pyogenes. Very simple and easy. You can easily, score good marks with this. Okay. So now, yeah. So this everything what I mentioned is here. You can go through it once. Okay. And this is another shortcut to major and minor criteria for this thing. Okay. All mentioned, very easy. So yeah, so we're coming to the end of the topic. So I hope that today's class, which is, it must be very important, definitely expected questions for everything. Till lifelong, you'll be having questions from this part. Okay, that's all. So thank you once again. So we'll see you soon in another class. So now it's time to say bye. Catch you later.
Thank you, sir.
Sandeep, okay, done, no? Yeah.
No, thank you, sir.